Our final session will be a panel discussion with Leek and Heather Bertasius. Katie is the lead for Tissue Viability and Continence at the University Hospitals of North Midlands. She has an MSc in Skin Integrity and Tissue Repair and is an independent V300 prescriber. She also has a keen interest in quality improvement and harm reduction. Heather is Moving and Handling Service Lead for the Royal Wolverhampton NHS Trust and Chair for the West Midlands Local Back Exchange Group. Both will be discussing their thoughts about patient hygiene in general and more specifically about the use of Ecomist, a new innovation advancing patient experience and staff delivery for this essential area of care.
First of all, Katie and Heather, I wanted to thank you for joining us today to share your thoughts and experiences. We're really grateful that you can make the time with your clinical responsibilities. Thank you both. My first question to you both is very general. Why would you consider that patient hygiene is important?
From my point of view, obviously it maintains physical and mental health, preserves the pH levels of the skin and reduces opportunistic infections.
Thank you.
I also think it's an activity of daily living that is carried out by all of us. So it's something that should be continued when a patient is admitted to a hospital.
Yeah, absolutely. And what would you both say that the difference good hygiene makes to? You've spoken about how it's both a physical and a mental need. What would you say good hygiene does for patients' psychological well-being?
Improves their self-esteem. It improves their mood. The patient's less anxious, and it just provides normality of a task that, as we say, they should be doing perhaps independently previously before coming into hospital.
I think it also helps them to engage with rehabilitation as well, because as mentioned by Heather, with the improving the self-confidence, that engagement then is better with the members of staff.
Yeah, perfect. And from a clinical point of view, you'd mentioned skin pH and opportunistic infections. Why would you say that patient hygiene is an important intervention from a clinical point of view?
From my point of view, obviously it does reduce moving and handling tasks in general. It improves. When we were using, obviously, the kit, it made a big difference in terms of moving and handling those patients. I think posturally it can be difficult to try and implement personal care sometimes to assist.
I think having that one-to-one time as well, or obviously if there's two members of staff and the patient, it allows the patient to open up and start that conversation, making every contact count, using the NHS acronym there. So if they have any concerns or anxieties about their care, then hopefully they can discuss during this time.
So it's that opportunity to have that individual kind of time, the opportunity to talk. It's an intimate moment, but you've got the opportunity to share, which will obviously then have an impact on your mental, your psychological well-being, wouldn't it? You mentioned the use of the Ecomist and reduction of moving and handling there, Heather. I was going to ask challenges for healthcare professionals delivering good patient hygiene. What would you say are the main challenges delivering general basic, hygiene to patients? What are the challenges that healthcare professionals have?
I think it is that finding that time, which can be challenging in terms of availability, staffing time, access to equipment, the availability of equipment. It can be all very challenging, accessing skin folds, patients' reluctance to it all sort of like contributes to the difficulties that we have on the ward areas currently.
Katie, did you want to add anything to that?
I think in acute, most acute trusts now have the pulp bowls as well to assist patients with their personal hygiene. If the wash is quite lengthy, so if the patient's being nursed in a critical care setting, for example, so they have to do everything. Sometimes having those pulp bowls is quite problematic. So obviously one pulp bowl should be enough. Most wards double them up. Sometimes partway through the wash, the water will go cool, so they'll have to go and get a fresh bowl, which obviously increases the waste, increases the resources used, increases the cost, but also increases the time for the staff and the patient going through that procedure.
Mm-hmm. Yeah. And we were talking, you mentioned, Heather, refusals of care, and that was the subject of Tamara's discussion for her patient group. Which patients are the most challenging to deliver hygiene to, in your opinion?
I think that the patients that are most challenging tend to be those that have got larger morphology, limited gross motor skills. Stroke patients can be difficult, patients with dementia, patients on critical care that have got lots of adaptations and attachments are very difficult. So it can be very difficult, and obviously we want to encourage them just from a therapeutic point of view. If you've got somebody that's obviously participating in something, they do benefit mentally, and it gives them a can-do rather than a can't-do attitude, which is what we tend to get when patients are in bed for long periods of time.
Yeah. So try not to have the professional patient and do as much as they can get involved.
Yeah.
So if I move on to the use of Ecomist, you've both had the experience in your clinical areas of using this innovation, which for our viewers is the ability to deliver a shower experience to a patient who is bedbound and otherwise couldn't get into a shower themselves. You were talking about getting involved patients. Do you feel that the use of the Ecomist, did it help any of your patients to assist in their own care, or do you think it's possible for patients to use Ecomist to take part in their own care independently?
From our point of view, when we trialled it, we had very positive feedback, in particular with one of the patients that had quite a large morphology, and she said it did give her back her independence and dignity. So she was able to wash herself independently. She obviously fed back that the temperature was the same throughout and it didn't go cold. She was able to be allowed to wash her own private areas and when people weren't present, so we could leave her to use it herself. So yeah, so from our personal experience of it, it was a very positive feedback from the patients that used it.
How about yourself, Katie?
So we used it in a general medicine ward, and again had really good feedback. Patients were able to use it themselves, but also it reduced the number of staff that was required to assist that patient during the wash. The main benefit, I think, as well as obviously the water staying warm, was the hair washing. So there was some patients that had declined a hair wash because I don't know if every acute trust is the same, but we still have the plastic funnel that goes into a metal bucket, and then you put the water on the hair and obviously wash through and it goes into the bucket. You have to unplug the bed to do that, so obviously turn the mattress off, take the headboard off, etc. So the procedure in itself is quite lengthy. Or we have a shower cap, and if I'm honest, the shower cap never fully washes the hair. So these patients were allowed to have that hair washed, or able to have that hair washed to a good standard.
You were smiling at that point, Heather. Had you got a similar experience when you were talking about hair washing?
Yeah, we had the same lady with the large morphology had very long hair, and I don't think she'd washed her hair for months. We managed to wash her hair, and what I found quite astounding was because her hair was long, I think it took about 6 minutes to wash it, but the actual water that the residue of the water that we used was really tiny, which I found I couldn't believe the amount of water that we'd actually used to wash the hair. Yeah. So yeah, it makes a big difference.
A real wow, right?
Yeah, it was a wow, because we drained it off, and it was just a small amount in the bottom, and I thought, well, I'm not sure how we've washed the hair with that amount of water, but we have. Yeah, so yeah, it was good.
So it's obviously really benefited your patients and brought, you know, the well-being. How about your nursing teams, the providers of care? What feedback did they have after using Ecomist?
They again, it was positive. They said it saved time, because I know we use the pulp bowls, but sometimes we don't always they're not always there. It's sort of difficult when you've got to maintain consistent fresh water at a consistent temperature, because it's not possible always to do that. The water goes cold, and then patients don't want to continue because it's uncomfortable. So from the staff's point of view, I think they were able to go and do other tasks as well. They could leave the patient to carry on, and obviously safely, but you know, if they needed help, they could press for the assistance. But pretty much it was very useful in releasing staff time. So yeah, their feedback was good.
Amazing. How about you, Katie?
Very similar, really. They did say that in between patients, they could move quite quickly, obviously clean the machine down and then move on to the next patient. So obviously you don't have to go and grab the bowl and the towels and the wipes, etc. for each individual patient, which was good. They said that the water used was minimal. So from a water waste perspective, there wasn't much used, as Heather mentioned, with the hair washing, which they were quite amazed at. And the other thing was they said that patients seemed to enjoy it more than having that bed bath, which was a nice comment, I thought.
Yes, going back to the patient's experience and their well-being. Did you both find that the Ecomist was hard to incorporate into practice, or did staff take to it and find it quite easy to adopt and use? Well, your patient was using it in your case at one point, Heather.
Yeah, no, it was easy to use. Wasn't difficult. It's easy to move around. Yes, it doesn't take an infinite amount of space up, but obviously you do need to store it somewhere. But pretty much it was very easy to use, and it did, as said, it did cut down on going backwards and forwards, getting water and making sure that it was the right temperature. So yeah, so it was good.
Perfect. How about you, Katie?
We had one challenge, and it's quite a simple one, really. Who was going to turn it on in the morning, the machine, to allow the water to warm? So the way we overcome that was the housekeeper took responsibility for that. So she came in, she plugged it in, waited for it to warm, and then informed the nursing staff that they could start the washes.
Perfect. But other than that, all good?
All good.
All good. Perfect. What would you both advise anyone who would consider using Ecomist for patient hygiene?
For me personally, I'd say trial it and evaluate its use. In fact, use it on yourself. Feel what it's like, and this will allow you to assess whether patient sort of like needs, I don't know, it quite light if they're hot and sweaty, or they need a more thorough cleanse, because you can obviously adjust it. So I think for me, I would say trial it, use it, and certainly see what it feels like on your own skin. And that gives you a very good indication on what that feels like for your patient.
Yeah. How about yourself, Katie?
I completely agree. Evaluation is the key probably with it, because I think when you see the system, there's probably a lot of questions before you start to use it. The other thing is, following on for evaluation, is to do the cost analysis. And it's quite surprising that there is a saving, albeit quite minimal. It's still a saving, and if it's better for the patient and you're saving money, then it's good all around, I suppose.
As well as the staff saying it's saving them time and giving them time back as well when we're clinically challenged as well. Are there any thoughts from either of you before we conclude? Anything else you'd like to say?
I think probably it's maybe I think potentially it's the way forward with patient care around personal hygiene and promoting normality and dignity. Really, it endorses independence. It reduces deconditioning and the feeling that of embarrassment for some people, because they just want to be able to sort of maintain their own hygiene. The water usage, as Katie said, was insignificant, so it was a real reduction in usage and a reduction in carbon footprint, as obviously we used less resources. So I think if you were to actually weigh it all up in terms of resources and time and carbon footprint, then the actual outcome might be even more significant. So it might be worth actually undertaking that piece of work to find out exactly what the cost and the savings are. Yeah.
Thank you. Anything else from you, Katie?
No, I completely agree. It is a unique system, and with obviously a lot of hospitals now not having access to baths and only having showers, it just opens it up to that other category of patients. Yeah. So yeah, I think it's been a real benefit for us, and we're going to critical care next to evaluate.
Yeah. Fantastic. We look forward to joining you there, definitely. Thank you both so much for sharing your thoughts and experiences with us today. I'm certain our audience will want to interact with you as well.